Welcome in from the Jackson County Health Department Deputy Health Officer Matthew Budd, and making her debut on JTV, Immunization Administration Clerk. I already messed up the title, Anna Holeman. Welcome to the show.
Thanks for having us.
Yeah. So it's Immunization Administrative Clerk.
Yes.
That's a mouthful. Have you thought about maybe applying for a different job?
They won't let me.
It's hard to say. It's hard to say. All right, so this is the time of year. It's back to school time. Mm-hmm. Is this your busy season?
It is, yes. We're starting to see a lot of kids come in, getting ready for school, getting those shots that they need, young and the older kids too. Everybody always is in need of something, making sure that they're up to date.
We've talked about this all during the pandemic. People renewed hesitancy to get vaccinated, and it's a result of all of the misinformation and controversies surrounding the COVID vaccine.
Right. With the release of the COVID-19 vaccine, there's hesitancy around all other vaccines. Mm-hmm. So great vaccine successes with polio and a whole bunch of different diseases that really were around in the early 19th century that we've pretty much eradicated from the U.S. There's fear of some of those coming back because we're seeing dips 5 to 10% in vaccination rates for a lot of those different diseases. Even flu vaccine, we're seeing like 10 to 15% less vaccination rates each fall.
And that doesn't just affect the people who choose not to get vaccinated. It affects everyone.
That's right, and fortunately we are very busy, in the back to school season in particular, because the more children who are vaccinated in the schools, the safer everyone's going to be. You have less people to bring those diseases into the school place and into the community.
So kids going back to school, and I think there's different ages or different grade levels that have different requirements. What do parents who are maybe sending their kids to school for the first time, what do they need to know?
So, for the most part, kids joining preschool and kindergarten groups, they tend to need those 4-year-old shots. And then again, it gets reassessed at 7th grade. Now, if they're entering a new school, we always recommend that they just double check that shot record as well.
Now, these would be shots that you would normally be getting as just a part of your visits to your pediatrician, right?
As well visit, yeah, a child visit.
Yeah.
So it's not like, it won't be a surprise. It shouldn't be a surprise to people that these are the vaccinations.
Right, it shouldn't be.
Yeah, right, and there's a lot of vaccines that we have nowadays. We've been able to find preventatives for a lot of different diseases, and a lot of the different vaccines out there require 2 or 3 different doses. Hepatitis B is one of the early ones, for an example, and that's 3 doses. So it is a lot of returning back to the primary care provider or back to us in order to make sure you have all those shots in the series. And each of those doses really just help improve the immunity we have to those diseases.
Yeah, as you said, there's a lot of different vaccinations and different courses, 2, 3 sometimes. Let's talk about COVID, for example. We're hearing that there might be, or there's supposed to be a reformulated booster coming up. What's your recommendation? Should we wait until if and when that comes out?
We were just talking about this because we hear the same thing. There is an updated formulation coming this fall, anticipated, and I think it varies. And I very much recommend to talk with your healthcare provider if you are older, immunocompromised, have some underlying health conditions, and maybe aren't sure if you've gotten an updated booster or it's been a little bit a while. Just that talk and conversation with your primary care provider could be helpful. Because for some people, especially if you're at high risk, getting COVID right now might be very bad, very detrimental. For other individuals who are pretty healthy, maybe low risk factors, waiting until the fall for that updated vaccine might be the right choice.
And it's also, you may be able to do it at the same time. When's the flu vaccine? That's fall too, right?
Yeah, middle of September.
Do we know anything about this year's flu vaccine?
We don't. We will be attending a informational session.
Second week of
September.
September.
2nd week of September. And then they'll tell us all about what's going to be in this year's vaccine. And then the next day we'll begin giving that vaccine.
Where's the best place to get a vaccine? Because the health department does it, your primary provider, pharmacies do some vaccines.
Yep.
Does it take all of you in order to make sure everyone's getting vaccinated?
Oh, yeah. I think whatever's the most convenient for people is probably the best option.
Yeah, wherever you'll get it is the
Yeah.
best place to go.
Yeah.
Yeah.
And I know you've had some pharmacy partners in the community. I think the pharmacies are much more engaged in vaccinating, especially for flu and now COVID, but even some childhood vaccines nowadays. So a lot of the pharmacists have really taken the last few years to improve the way that they're working with the community members to help prevent disease and illness.
Well, I think we've all become more aware that vaccines are pretty important, and particularly when there's some pretty serious things we're being protected from. HPV, that's another vaccine, and it can be confusing to families because there's advertising for it. And when there's advertising, it's like that means there's somebody that has a stake in this position. What is the health department's stand on HPV, what ages, and everything else that people need to know?
Yeah, HPV is a big one. We have a lot of parents come in, and especially parents, because it's recommended for teenagers.
Recommended, but not required.
Right, and that's where a lot of the, we might see advertisements because it's not required. It's not one of the life-threatening diseases. A lot of the vaccines that are required are passed through the air or droplets, so kids can pass it just by being next to other kids. Whereas HPV, people usually think of HPV as a sexually acquired disease. And in a lot of cases that might be true, but really the HPV vaccine is a cancer preventing vaccine. It can prevent a lot of different cervical cancers and throat cancers, and that they're finding that's the biggest benefit, is it's preventing cancer in later life. Because a lot of us go on to get married and have children, and HPV is very prevalent.
Yeah, in the earlier, we start offering that vaccine at age 11, and one thing our nurses usually tell the patient or the parent is, if they start early, they'll get one less dose because that risk factor is a little lower when they're younger. But once they turn 15, the risk studies show that it goes up, so they would need an extra dose of that vaccine. So that's, if you start earlier, might avoid a poke.
And it's a newer vaccine. I'm thinking back, it's about 20 years old now. And at first it was just recommended for women, and then it became recommended for boys, and the age has gone down because it used to be 16 and older.
Yeah.
So we're learning more. And it's one of the things that I love about healthcare, although it's frustrating to go in and not know everything right at once, but to see the effects and learn more about things and then make better recommendations.
How about supplies of all the vaccines? So we've heard different stories about various drugs being in short supply, and I think sometimes in some years the flu vaccine.
Yeah, definitely. It can be we haven't seen any issues in the past few years. We have great supply of all vaccines, have no issues.
Yeah.
So
I think flu was a bit of a challenge last year with high dose.
High
flu.
dose, yeah.
In our community,
Yeah.
it was a little bit harder to get, but we're hoping it should be a little bit easier this year.
Yeah.
But so far, so good for vaccines.
Nice. And how long have you been the immunization administrative clerk at the health department?
7 years.
Great.
Yeah.
And besides vaccines, that's pretty much that's your whole day, right?
I do, yeah. I cross over a little bit into our other clinic, our sexual health clinic, and I just try to help wherever I'm needed.
All right. And if people have any questions or they want to get details on getting their immunizations, you're the people to get in touch with.
Absolutely.
Yeah, give us a call, visit our webpage.
All right. And you've got the website with everything on there. And I think we should also say hi to your stepdad today, don't you think?
Sure. Hi to my stepdad, Pat Mano.
Pat Mano, thanks for watching. Pat, longtime viewer, and we appreciate that. Pat Mano, thanks for tuning in. And thanks for coming on the show today.
Thanks,
Yes,
Bart.
thanks.
Matthew Budd, Deputy Health Officer and Immunization Administrative Clerk, Anna Holeman. Up next,